Okay, this is the oral station. You're responsible for all aspects of scene management and patient care. You have 15 minutes to verbally complete a simulated out-of-hospital patient encounter. Remember to verbalize everything. I will play the role of bystanders and everyone else. Ask me any questions you may have. I will explain your crew as a part of the background. You may take notes throughout the whole thing. Do you have any questions?
I do not.
15-minute time limit. Begin as soon as I read you verbally the case. Scenario. You respond to a parking garage for a possible assault victim. Police are on scene when you arrive. As you arrive, they are waving you over towards them. They are standing over your patient, who is lying prone on the ground, a small puddle of blood around his head. You do not notice any spontaneous movement from the patient as you approach. An officer has secured a tire iron approximately 10 feet away from your patient. You have backup of 4 fire department and 4 ALS providers on your ambulance. Full ALS equipment.
Okay. Ready?
I'm ready.
Okay. So I'm gonna have my BSI on. My scene is safe because I have police officers that secured the scene and they waved me in.
Correct.
I have all my additional resources here. I got 4 ALS units and 4 fire. Yeah, 4 fire guys. So I got my BSI on. My scene is safe. My mechanism of injury for my patient is going to be a blunt tire iron. That's got blood all over it. I'm going to have one of my partners hold C-spine of my patient.
Yeah, consider done.
I am going to not request for any additional resources because I think I have all my resources with me. I'm going to bring in all essential equipment with me. Yes.
Yes, you have all the equipment with you.
Yeah, I have all the equipment with me. Okay, C-spine. Okay, I got all that. My general impression of the patient is that I have a male laying prone. Appears to be that he got struck in the head by a metal rod there, tire iron.
He's approximately 35 years old.
35 years old. Okay, so as I approach my patient, is he aware of my presence or anything like that? Okay, I'm gonna do a rapid trauma assessment on my patient. Check for any major bleeding or anything like that.
You noted bleeding laceration to the back of the head.
Okay, I'm going to go ahead and have one of my partners put a bandage that bleeding laceration on the back of the head. I am going to assess the level of responsiveness on my patient. Is he verbally responsive?
He is unresponsive to verbal.
Okay, painful stimuli?
He does respond to painful stimuli.
Okay, he's responsive to painful stimuli. Does anybody know what happened? Anybody see what happened? Or?
No one knows anything.
Okay. So I'm going to assess his airway. Assess his airway.
Well, what do you like to know about his airway?
Is his airway open, patent?
His airway is open and patent.
Okay.
Looking at the airway, you notice 3 front teeth have been knocked out.
Okay. No snoring respirations or anything like that.
The patient is breathing at a rate of 26 times a minute with an irregular pattern.
26 irregular. Okay, what's this skin like? Cool, pale, clammy?
It is cool, pale, and clammy.
Pulse?
He has a radial pulse that is rapid and weak bilaterally.
Rapid and weak. Alright. So, at this time, my patient's going to be a high priority patient. We're going to transport him as a high priority. I'm going to treat for shock in this patient. I am going to... we're going to go ahead and put a C-collar and backboard this patient, but before we roll my patient onto his back, I am going to assess his back, looking for any decap BTLS in his back of the neck or the head or his back or anything like that.
None noted.
Okay, so on the count of 3, on C-spine's count, we're going to roll my patient onto his back. Okay, so we're going to roll him onto his back. Does he change or anything like that? Does he moan and groan when we move him?
He does not.
Okay. So I'm gonna go ahead and I'm gonna put a C-collar on my patient, but before I put a C-collar on, I'm gonna assess his neck for any JVD or tracheal deviation.
You see no JVD or tracheal shift.
Okay, so I'm gonna put the C-collar on my patient. I'm gonna go ahead and start my focus assessment, and I'm going to first I'm gonna put oxygen on my patient, 15 liters non-breather mask.
All right, consider done.
I am going to start from the head of my patient. I'm going to look for any decap BTLS on his head.
You notice a possible skull fracture on the left side.
Left side, I'm going to note that. Any ears, any CSF, blood?
You notice blood and/or CSF draining from the left ear.
Okay. Any battle signs or anything like that?
No.
Okay. Eyes.
Uh, right eye pupil is dilated and fixed. The left is about 4 millimeters and reactive.
Okay. How's my patient's breathing doing? Is he still doing?
He is still breathing 26 times a minute and irregular.
Okay. At this time, I'm gonna go ahead and have one of my partners breathe for him via bag valve mask
Okay.
on high flow too. Okay, so we got the neck. We got the neck checked and everything. I'm gonna go ahead and check his clavicles for any decap PTLS.
None noted.
Okay.
Clavicles are equal bilaterally.
What's that?
Clavicles are equal bilaterally.
Okay, I'm gonna listen to his lungs. Anything noted in his lungs?
You might hear some fluid in the airway.
Okay. Any
Upper airway.
any paradoxical motion or anything like that?
No,
or...
it's equal bilaterally.
Okay. Any bruising or anything?
None noted.
Okay. I'm gonna check his abdomen, all 4 quadrants for any tenderness, extension, or anything like that.
Abdomen is soft and non-tender in all 4 quads.
Okay, I'm going to check his pelvis for
Stable.
stability. Okay, I'm gonna go down to lower extremities. Anything noted in the lower extremities?
None noted.
CMS.
Present.
Upper
Except
extremities.
the patient doesn't respond to sensation.
Doesn't respond. Okay. Upper extremities.
Same.
Same. CMS good.
Mm-hmm.
Okay. I'm gonna go ahead and get a set of vitals on my patient.
Blood pressure 186 over 118 millimeters of mercury.
Over 118.
Yep.
Okay.
Pulse is 58 beats a minute. Respiration is 26 breaths a minute. Irregular. SaO2 on room air was 94%.
94%. Okay, my patient's gonna be a load and go patient. I'm treating my patient for shock. I am gonna go ahead and get two large bore IVs, ACs on my patient. Get normal saline running at TKO.
Oh, consider that done.
Okay. Normal saline at TKO. We're gonna rapid transport. I got my patient on a BVM.
Okay.
And I'm gonna call in. I'm gonna reassess my patient every 5 minutes. He's a critical patient.
Sure.
I am going to call in the report to the hospital.
All right, you may begin with your report.
Okay. I have a 35-year-old male found prone position. Possible left skull fracture of my patient. Patient is responsive to painful stimuli. Patient has dilated left fixed pupil, blood drainage from the possible CSF fluid drainage from the ears. I have 2 large bore IVs, AC. Last set of vitals was 186 over 118. Pulse is 58. Respiration is 26 and regular, but it's being controlled by my BVM mask at high flow O2. Skin is cool, pale, and clammy, but we have a blanket over him and treating for shock. And we will be arriving in a few minutes.
All right.
I am done with the station.